Nicorette Lozenge can help you quit smoking by replacing the nicotine in cigarettes. When you stop smoking, your nicotine levels drop quickly, which can cause withdrawal symptoms such as craving tobacco, nervousness, irritability, headache, weight gain, and difficulty concentrating. It is best to use Nicorette Lozenge as part of a total stop smoking program that includes behavior change, counseling, and support. Stopping smoking is important for improving your health and living longer. When using Nicorette Lozenge, it's important to follow the directions carefully. If you're using the over-the-counter product, make sure to read all the instructions on the package. If your doctor has prescribed it, be sure to read the patient information leaflet before starting the treatment. To use the lozenge, don't eat or drink anything for 15 minutes before and while it's in your mouth. Start the medication on your quit day and suck on a lozenge when you feel the urge to smoke. Let it dissolve slowly in your mouth over 20 to 30 minutes, and try not to swallow it. During the first 6 weeks, use one lozenge every 1 to 2 hours, but don't use more than one at a time or continuously use one after another. After about 6 weeks, start using fewer lozenges each day until you no longer need nicotine replacement. It's important to complete the 12-week treatment, and if you still feel the need to use this medication after that, talk to your doctor. If you suddenly stop using it, you may experience withdrawal symptoms, so your doctor may lower your dose slowly to help prevent this. If you're unsuccessful the first time you try to quit, you may need to stop using the product and try again later. Some common side effects of Nicorette Lozenge may include mouth sores, hiccups, nausea, sore throat, headache, heartburn, or dizziness. If these effects persist or worsen, it's important to stop using the medication and consult your doctor or pharmacist. When you stop smoking, you may also experience nicotine withdrawal symptoms such as dizziness, anxiety, depression, or trouble sleeping. If your doctor has prescribed Nicorette Lozenge for you, it's because they believe the benefits outweigh the risk of side effects. Many people using this medication do not experience serious side effects, but it's important to be aware of potential serious side effects, especially if you continue to smoke while using the product. Serious side effects may include severe dizziness, mental/mood changes, numbness/tingling in hands/feet, or swelling hands/ankles/feet. Stop using the medication and seek medical help immediately if you experience chest pain, confusion, severe headache, fast/irregular/pounding heartbeat, trouble speaking, or weakness on one side of the body. While a serious allergic reaction to this drug is rare, seek medical help right away if you notice symptoms such as rash, itching/swelling, or trouble breathing. This is not a complete list of possible side effects, so it's important to consult your doctor or pharmacist if you notice any other effects not listed. If you're in the US, you can call your doctor for medical advice about side effects. You may also report side effects to the FDA. In Canada, you can call your doctor for medical advice and report side effects to Health Canada. Before using Nicorette Lozenge, make sure to inform your doctor or pharmacist about any allergies you may have, as this product may contain ingredients that can cause allergic reactions. It's also important to discuss your medical history, especially if you have conditions such as diabetes, heart disease, high blood pressure, or thyroid problems. If you have phenylketonuria, PKU, or need to limit aspartame in your diet, talk to your doctor or pharmacist before using this medication, as it may contain aspartame. If you are pregnant or breastfeeding, it's important to discuss the risks and benefits of using this medication with your doctor. Nicotine from smoking and this medication can harm an unborn baby and pass into breast milk, so it's important to take precautions. When taking Nicorette Lozenge, it's important to be aware of any potential drug interactions that could affect how your medications work or increase your risk for serious side effects. This is why it's important to keep a list of all the products you use and share it with your doctor and pharmacist. It's also vital to inform all your healthcare providers that you are quitting smoking, as stopping smoking can change the way the liver removes certain drugs from the body. Nicorette Lozenge can be beneficial for those looking to quit smoking. The recommended daily dosage varies depending on the individual and their smoking habits. It's best to use the lozenge at the onset of cravings or at times when you would usually smoke. Remember to always consult with your doctor or pharmacist before making any changes to your medication regimen. If someone has taken too much Nicorette Lozenge and is experiencing severe symptoms like passing out or difficulty breathing, it's important to call 911 immediately. Otherwise, contact a poison control center right away. In the US, you can call 1-800-222-1222, and in Canada, contact your provincial poison control center. Symptoms of overdose may include confusion, drooling, seizures, slow or shallow breathing, and hearing problems. Do not give this medication to anyone else. If you forget to use Nicorette Lozenge at your usual time, use it as soon as you remember. If it's close to your next scheduled dose, just wait and take the next dose as usual. Don't take a double dose to make up for the missed one. Remember to use Nicorette Lozenge as directed to get the most benefit from it. When storing Nicorette Lozenge, make sure to keep it at room temperature away from light and moisture. Avoid storing it in the bathroom. If you have a partly used lozenge, wrap it in paper and throw it away in the trash where children and pets can't reach it. It's important to keep all medications away from children and pets. Remember not to flush the lozenges down the toilet or pour them into a drain, unless specifically instructed to do so. When the product is expired or no longer needed, be sure to properly discard it. If you're unsure of how to do this, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.